And whenever you're ready, Dr. Munger.
All right. Good evening, everyone, and welcome to the World AIDS Day event hosted by the ladies of the Jackson Alumni Chapter of Delta Sigma Theta Incorporated. I am excited to have each and every one of you all here on this evening to have this discussion. Without being inconsiderate, I want to send my thoughts and prayers to everyone, hoping that everyone is safe. We do have some pretty tumultuous weather here in the Mississippi area as a whole. The entire state right now is impacted by storms. So if there's by any chance a person needs to exit for your safety or your family's safety, we totally understand that. But just wanted to make sure that I mentioned that first and foremost. I am your host and moderator for this evening. My name is Mada Munger. I am the Chief Operating Officer at My Brother's Keeper in Jackson, Mississippi, as well as the Chief Executive Officer of the She Project, a nonprofit here that focuses on issues surrounding women and girls. I've had the pleasure of working in the field of HIV for about 17 years now. And I've had the ability to work in many different genres. So I've done research, I have done work in the health department. I've also worked in a clinical setting, and currently, as I mentioned, I am in a community-based organization. So I have a little bit of a history on this and a little bit of knowledge. I am so excited to allow my panelists also to introduce themselves. I'll call each person by name and then ask them to tell us just a little bit about who they are, their background, and where they work. So without further ado, I'm going to start with Ms. Hargis, Ms. Aspen Hargis. If you can tell us a little bit about who you are, where you work, and just why this work is important for you.
Well, good afternoon, and thank you so much for that introduction. And I would just like to say first, thank you to the ladies of Delta Sigma Theta Sorority for inviting me to speak on such a subject that I'm very dear to. I started this in 11 years ago. August 1st made 11 years that I have been working as a clinical social worker at Hattiesburg Family Health Center. Our organization is called SIMRI, Southeast Mississippi Rural Health Initiative. As of now, I wear many hats. First and foremost, I am a licensed clinical social worker, and I provide mental health services for our clients living with HIV. And I like to use the word living because they are living and they are thriving. Just like anyone, when you are diagnosed with HIV, you need someone to talk to. Depression may set in, adjustment disorders may be there. And so I'm their person. I don't identify myself as a therapist. I tell them I am a sounding board. I am here to listen to you. I am here to guide you. I'm here to help you develop a plan that will work best for you in the years to come. I'm also the assistant director of the social services department. And with that, I work in conjunction with my beautiful boss, Ms. Tanya Green. And she and I work together to make the program one that people can come to and receive quality care and also services. So again, I am proud, happy to be here, and we have some exciting information for you guys.
Thank you so much. I'm going to go next to Ms. Carrington Blair. Ms. Blair, can you introduce yourself and tell us a little bit about who you are?
Yes, ma'am, I surely can. Good evening, everyone. I too would like to say thank you just to JMAC for inviting me here to just share this moment and this monumental day with you all. My name is Carrington Blair. I am from Houston, Texas. I go to school at the Jackson State University. I'm a junior criminal justice major, and I'm also a member of the Delta Pi chapter of Delta Sigma Theta Sorority Incorporated. And I'm just so blessed and happy to just be able to be here and just shed more light on this situation that's occurring within our communities and just all around the world. So thank you guys again.
Thank you so much for being here. I am going to go next to Miss Alicia Barnes. Ms. Barnes, if you can tell us a little bit about who you are and where you work.
Good evening. I am Alicia Barnes. I too would like to thank the ladies of Delta Sigma Theta for thinking of my brother's keeper in open arms and having us as a part of your panel. I've been working in the healthcare realm for over 20 years. I started in the federally qualified health center. I've always been compassionate about people of color, the underinsured and uninsured, which is the mission under the federally qualified health centers. I later on started my own consulting company around health information quality. And so I've worked with the State Department of Health around several initiatives around health disparities and hypertension, diabetes, those things that affect us the most around improving health outcomes. I consider myself to be a person that's a systems change agent. So looking at systems and processes to see how that we can redesign the system to improve the resources for us. I currently work at Open Arms Healthcare Center as the Chief Operating Officer, and there I am the lead on our Ryan White infectious disease programs and services that we provide. We do also have rapid testing at our Hattiesburg site and also our Gulf Coast site that we will talk about a little bit later. Again, just excited about the work that we do in trying to provide the services that are much needed in the state of Mississippi and abroad.
Awesome, awesome. And now I am going to have my sister friend, Miss Linda Stringfellow from the mighty Mississippi Delta, to come in and tell us a little bit about what she does and the amazing work that she's been involved with quite some time. We've been in this game together for a long time.
Yes.
So Miss Linda, I'm sorry. She told me stop calling her Miss Linda. I'm trying to be respectful, you all. Like I got some sense, you know. But Linda, will you go ahead and tell us a little bit about you?
Sure. Good evening, everyone. I'm L. Nicole Stringfellow. My role, I'm the founder and executive director of Fabric Incorporated. We are a nonprofit based in the Mississippi Delta, but we serve the entire state. And we have two main focus. The first part is making sure that we empower women. We put a heavy emphasis on sexual and reproductive health. Definitely, we do a lot of work with HIV. I've been doing a lot of HIV work since 1994. I had my fingers and toes pulled out trying to add up the years. I stopped after the second foot. So, and I also am the regional vice president for Together for Hope. We are a rural development coalition where we received a $100,000 grant to work with communities of faith to get them more involved in HIV work. So yes, we have some grants announcements coming. My passion started in 1994 when my childhood friend became positive. She was 29 years old when she passed away. And if you all go back to 1994, we know HIV was not showing up in our communities. People did not look like us on the screen. So I've been in it that long. I was called to the call, into the fight, because my friend and then the lion came into my immediate family. And so I've been in the fight ever since then. And it has definitely been a journey. I'm ready to talk. I do the work and I speak the truth when others cannot, for whatever reason. And like the Lorax stood in place for the trees, I stand in the place and be the voice for the people that still cannot speak up and be heard because of their status. I am, since you all started this, I am a graduate first. My roots are Black. I am a graduate of Mississippi Valley State University, and then another degree from Delta State University, and another degree from the University of Southern Mississippi. And I'm a proud member of Delta Sigma Theta Sorority Incorporated, Bolivar County Alumni Chapter in Cleveland, Mississippi. That's right, throw those hearts, throw those hearts. So that is it for now. Thank you.
Listen, this is a phenomenal group of women. I am familiar probably with everyone but Miss Carrington. So I know the quality of these ladies that you're going to hear from tonight. I also know the vastness of their experience and their passion for the work. So I'm excited to engage each one of these young ladies tonight, each one of these ladies. It's so excited to engage you all. I did not say this, so I'm going to go ahead and say this, everybody put it out there. I'm a proud graduate of Tougaloo College over there, you know, the Lou, as we call it. So I'm a proud graduate of Tougaloo College, but I am also a very, very, very proud graduate of the Jackson State University with 2 degrees from JSU. So I got love for blue and red one way or the other, right? Either it's at the Lou or at the. So so proud of this work and so proud to be a part of this initiative working around educated community around HIV and AIDS. So I'm just going to jump right into it because I'm telling you, this panel is dynamic. So I know the time is going to pass fast. I'm going to get straight into it. We know that African Americans bear the brunt of HIV cases in the United States. Currently, about 50% of those diagnosed with HIV in the United States as a whole are African American. Mississippi is no different from that. So I'm just going to get right into it. From your experience, what are some of the key factors as to why this community is so heavily impacted? Now, Linda, I'm gonna put you last on purpose because I know you're gonna run with something. I'm gonna start with you, Aspen. Why do you think, just a few things, why do you think African Americans are so heavily impacted about HIV, around HIV?
Okay, so let's get started. We've been impacted for a while. Our community have been impacted. It goes from generations to generations. And so if you are raised by your grandmother, like myself and also my beautiful Black mother, we don't trust the system. We don't trust that if I go to a doctor's office, they're going to provide me with quality services. So it starts back from generations. So for me, it's that generational history and that we don't trust. We just don't trust our medical providers. Also, you know, we have to get into where we live. You know, we live in Mississippi, right? And so when we talk about living in Mississippi, what is there for us to do? What kind of activities are our children involved in? And then we also push what I talk about, abstinence, refrain from sex. And that's the conversations that we're having. Real conversations are not being had with our children, not in the school system, right? In the school system, they don't talk about condom usage. They don't talk about how to protect yourself. They're not introducing PrEP or PEP to our students, and we know that they're sexually active. I tell people all the time, I am a proud teenage mother. And so I was pregnant at the age of 16, delivered at the age of 17. And so did someone talk to me about those particular things? Maybe they did, but I didn't listen. Right.
You maybe weren't hearing it enough, right? So
there you go.
In order for something to sink in, we need to hear it multiple times.
Exactly.
So I'm gonna ask you that same question. You work in a clinical setting, right? So
yes.
Really what they do at Open Arms is really about it's primary care infused with sexual health. So what do you think are some of those key factors as to why we see rates so high in the African American community?
I would agree with Aspen, but I also think is stigma. Mississippi, as we stated, is the Bible Belt. So faith-based. I hear a lot of my staff as well as patients say, well, I don't want anyone to know my church, you know, I work in the church, I'm a music ministry person. I have different roles, different titles. So I don't want it to be stated that I'm coming here or that I'm doing anything that's considered a sin or outside of what my faith teaches me. I also think is the social determinants of health. I do think that a lot of patients that we have to come into the clinic are dealing with their low income, they don't have insurance, they don't have transportation. So I think that is the resources or even access to care. And then also being culturally competent. I have a lot of new providers who come from the federally qualified health center world. And it's not to knock them, but they're not culturally competent to see a patient that comes in the clinic that may have a mustache, but have a dress on. So being able to relate or even have the empathy or have the conversation on what's going on with you. Our medical director will always say a lot of times that healthcare providers are not taught having sexual conversations with their or conversations with their patients about sex other than are you having sex? But in this context, we have to dive a little bit deeper. Who are you having sex with? You know, male, female, both. What does that look like? How often? So I do think it goes back to the education, awareness, but not just from parents and students, but also from healthcare providers. Just we have a lot of healthcare providers that will refer their patients to us when they test positive because they don't want to deal with being considered a HIV clinic, or they don't feel like they have the expertise. But HIV, again, is not what it used to be. It's a chronic disease. CDC tells us to implement it like we do anything else. So I think it goes back to a number of things, but I think here is starting those conversations so that people are more aware of what's happening. So as you know, you can do better.
Got it. So Linda, I'm gonna pull you in, and then Carrington, I want you to start to think about, as a young African-American woman, what has messaging been like for you? So Linda, if you can talk about the aspect of African-Americans, especially since you and I have been in the game for so long. So if you can talk a little bit about that, and then Carrington, I'm gonna come over to you. Go ahead, Linda, what do you think?
Okay, first I'm gonna be dignified. The first thing that I'm gonna say is a lot of it has to do with the community of origin that we learned as the public, and that is same gender loving white men, or term people use, gay white men. Automatically this is associated with that population, so we don't have to worry about that. Just like we did during the beginning of learning about the pandemic. And so we were like, oh, popping melanine is protecting us. And then when it hit our communities, the impact it had on our communities. Another thing, I think it has to do with the way that we were raised about sex. We were groomed, whether we were in the church or not, in the home. Sex is for grown people. Sex is really for sex and relations are for married people. And if you're not married, you shouldn't be doing it. And it's more about what it should be, or the perspective that it's painted and the way they raised us, instead of looking at the reality of. And I also talk about for Black communities, all we have is our name, the shame. Don't do anything to shame me. So you're compounding the situation of, you're talking about sex and you're going to shame our family name. All we have is our name. So how could you dare do something, or quote, bring something into the home or into the family that is going to damage our name? We also have been finding out, as the truth has been coming out more, some people just don't want to know the results. They don't want to get tested, don't want to know the results. And that's not just with HIV. And one of the biggest things that still irks the stew out of me is we have a lot of people in our community that doesn't apply to me because I'm married. A wedding ring is not a condom. A wedding ring does not protect you. I'm trying not to go there. I'm trying to smooth my way into this one. But because I'm married, I'm a church person, or I don't do this, I don't do that. This does not apply to me. Oh, my man not messing around. Yeah. So, okay, you married, but is he? Or vice versa. And the other part is for women don't understand. Women, we are by nature, we are entered into our sex, we are entered into. So it's easy for things to be deposited into us. I leave it the clean way. So we have to learn about the things that are being deposited into us, because we allow a lot of things to plug into us.
Physically and spiritually.
What you said.
Physically and spiritually.
That is
that's
correct.
The part that people don't realize, that soul tie. And when somebody is soul tying to you, often don't walk away from those situations, though we know that they may not be the healthiest, both and mentally, right?
That's correct. A wedding ring is not a condom, and a wedding ring does not protect us.
A wedding ring is not, that is a hashtag, you all. For World AIDS Day, wedding ring is not a condom, right? Wedding ring or a committed relationship is, and I put that in quotations, is not a condom. It does not equal protection just because, right?
Yes.
So thank you for that, because I was writing, y'all, if y'all see me looking down, I'm writing because these speakers are stimulating thought, but there is truly a perception that HIV is still only prevalent in the LGBTQ plus community, right? And so this perception of vulnerability, we're really missing that mark. I was reading some research recently, and the numbers among African-American women are going back up in the United States. Those numbers are going back up. So this perception that I'm not at risk or I'm not vulnerable, we got to change that, you all. We absolutely have to change that. Carrington, I'm gonna go to you. What have you been taught or heard about HIV that you, as a young woman in college, do you feel honestly like you've been prepared for this?
As a young African American woman in college, I would say no. I don't feel like I was prepared for this because, as stated before, we don't hear things enough. And I grew up in the suburbs, in the church, home, and just faith-based home and family. So we didn't hear like, oh, like, like we already wasn't talking about having intercourse because it's God, school, work, family, and friends. Like that was that. So not hearing things enough, like I don't think I was prepared for, the scary parts of the world, which to me is HIV and AIDS. So it's not scary in a bad way, but it's just something that if you're not aware of it, it can be scary if you just don't know. Because some people just don't know. And I feel like those are the vulnerable people that just don't know it. Because some people, like I said, just don't know. But I feel like the more that the topic is being like shed upon or just spoken about, and the more we can reach out to our community, and just like me as a young Black female, being able to tell like my friends or my sisters or my teammates, just being able to talk about some uncomfortable things at our young age, it's like, it just reminds us that like we are the future and things can start to change if we become aware of what's going on within our communities and just around us. Because like Black people already think they strong, like we already know that we're strong, but sometimes even the strongest people can seek help or can talk about things, or they can like just put their guard down a little bit. Because I just feel like as a leader or just as somebody that's wanting to build up a temple or just help people, you have to be able to accept and want help for yourself, because you don't know it all, or like you're not perfect and everybody is not the healthiest. Like everyone goes through something, everyone has faced something, everyone learns from mistakes. Like even the people that we look up to in life, the people that I've looked up to in life that I thought were perfect, have probably been through things that I've never known about. So just growing up and not knowing things, it just made me eager to like want to find out more. And like knowing that this epidemic is a real thing, especially amongst like our people, it's just another battle that I feel like we're coming head on and we're not bucking down on. Like, so I'm just ready and prepared to be able to like help in the fight at this young age. And yeah.
Harrison, you brought up a valuable point about how we as Black families are quiet. This whole quiet is kept. What goes on in this house stays in this house. And I don't think we realize the damage that it does when we proclaim that we're going to keep everything a secret. Because when we find ourselves keeping a secret, we keep knowledge a secret too. Because many of us will know something, but we too afraid to talk about it. Kind of going back to that stigma piece, right? I don't want to talk about it because if I talk about it, there's a presumption that something may be wrong with me, right? If I'm even bringing this up, like what's going on with her, rather than saying this is knowledge, I'm going to take this opportunity to share knowledge. We don't do that. We do not do that. So thank you for bringing that to light, because that is something absolutely in our community that we don't do enough of. So we got to start opening our mouths. If we're going to end this epidemic in the Black community, we got to stop the silence and start the conversation, right? Stop the silence and start the conversation. Now, you have brought up a couple of different groups. I heard faith, I heard family. So my next question is, and in order for us to get to a few more questions, I'm just going to ask one or two of the panelists, and then I'm going to roll on to the next set of my questions. But how have local, state, faith, and governmental agencies, as well as policies, assisted in ending the epidemic or not assisted. So I'm going to start with you, Alicia, if you can talk a little bit about that, and then I'm going to go to Linda, and I'm going to let you all handle these two questions. Government, faith, local policy, what are we doing? The people we putting in office, what are they doing around?
Government wise, I'll start there. Government wise,
Okay.
money is coming down. CDC is pushing out ending the HIV epidemic, so more money is coming down to community-based organizations for testing and linkage to care. Also HRSA, Health Resource Service Administration, who funds the federally qualified health centers, is pushing money out to the FQHC. So money is coming from a government standpoint on a national level. State-wise, there are dollars from the State Department of Health for Ron White services. But for me, that's all I see is money. I don't see the education. I don't see the hand holding. We'll talk about it a little bit more, but with My Brother's Keeper, we do have a capacity building grant. There's not a lot, and we offer technical assistance for community-based organizations and health departments / jurisdictions. We're not seeing the help coming in that should be. If we're talking about ending an epidemic and we're looking at the states that have the highest number of rates, no one is asking for assistance. And so if no one is asking for assistance, that is the reason why the numbers keep increasing, because there's a perception that assistance is not needed. How is assistance not needed when the numbers keep increasing? So I think that there's somewhere a silo, even within the offices that are supposed to be providing the support and the help. From a faith-based perspective, COVID, for example, COVID was one of those things where faith-based leaders came out to say, hey, there's a health inequity. We need to be seen on the forefront. In the HIV, we have to go to the faith-based communities. They're not coming to us. So again, it's one of those things of, am I my brother's keeper? You know, if we're talking about helping and doing, we as NAACP, what are we doing? We pushed COVID, you know, the Democratic Party. We are pushing these other initiatives, but yet HIV in Mississippi the rates are us, Black people. So I think that it starts there within our community. But on the state level, national level, it's money, but it's not the actual work, the action. You don't see the action. You see the money, but not the action. Some of the money that's coming into the state, I've heard a lot of health centers say, well, yeah, they're giving money. I do the testing, but I'm not going to do the work. What's the difference? If you're going to do the testing, do the linkage. It's chronic disease. No one really knew about diabetes when it first happened, but your providers learn. There are initiatives, there are support groups, there's training. There's no different with HIV. Faith-based, I think pastors have to stand up and say, like they did with civil rights and as they did with anything else, this is killing our people. So let me be the first to say, in spite of a spiritual standpoint, because healthcare is not spiritual, religious, or political, it's healthcare. So we have to take all of that out when we're talking about quality of life. So I think it starts with the pastor, the head, the lead. Most churches have health ministries, but most pastors allow the health ministry person to lead. But if the members or in the congregation saw the pastor say, hey, we're gonna do a HIV testing day, not from, you know, or just, oh, okay, yeah, the ministry is doing it, but this is why. And they put that data out there as we do with voting. And I say from this, all of that from a faith base, I'm a PK. My father is a pastor. We have a church. So I can speak of it from personal experience. Yes, my sisters are ministers, and one of my sisters is a dentist. So she pushes the fight from a health ministry standpoint. And it was a education thing. We had to educate my father. This is happening in the state of Mississippi. We need you to also be informed to take the lead, regardless of who's having sex. It's not a promotion of sex, it's a saving of life. And so are we saying that we're gonna, because the Bible says that we know people are having it. I'm also, as Aspen, I'm a teenage mom. Pregnant at 15, child at 16, but that's not the end of my story. So if I know that you can overcome teenage pregnancy, and all of these are interrelated. The sexual health conversations are not had, and people are getting HIV, same thing with infant mortality. It all works together. But again, I think the conversations have to start from the head. But if the head is disconnected to what's happening in their community, and I just don't want money. I want support. I want help in this fight. We don't want to just get the money, and then we have to figure out how to use the money.
Absolutely. Absolutely. Linda?
Yes.
I'm waiting to hear something. I'm thinking you're going to hit it. Alicia hit on a bunch of things. Come on.
Okay, well, I'm in the bus with Alicia, so I'm definitely agreeing everything she said. And to add a little lipstick and wig to the picture, I would definitely say when it comes to government, whether that's national or state, we removed a lot of money from awareness and prevention around 2014, 2015, because we healthcare professionals were being taught, as well as working under the perspective of it's not if a person become positive, it's when a person become positive. And so they already started preparing for when, but us in communities, we did not know healthcare professionals were focusing on the when, especially for young gay Black men. And it went, the ratio was going to go from 2 out of 5 to 4 out of 5. They were already preparing. And that was 2014 and 15. So they started shifting the dollars to reflect just that. And it's for care, what they say, linkage to care, get people in care and keep people in care. And so you will have chasers. People are going out and becoming positive so that they can get all of the benefits, because money is not with awareness and prevention. Now, let me slow down in my speech pertaining to our communities of faith. Our communities of faith used to be on the forefront when it came to education, civil rights, particular movements. But when we start talking about anything below the belt, we have got to stop beating people with the belt and smashing them over the head with the Bible. That's just the bottom line, because it has done so much harm to our individuals as well as our family. And some of the teaching has been used against people in the church, especially women in the church. But that's a whole nother panel discussion. When we talk about HIV, we've done research, our Closer Walk initiative. Last year, we did research with over 100 faith leaders, and majority were Black church leaders. And the information we found out, when we say HIV, faith leaders automatically associate that with LGBTQ and gay. It is not peanut butter and jelly. It is not sausage and biscuit. It is not an automatic association. So we automatically learned then that there is some education that needs to take place there. The other thing is, a lot of faith leaders told us, we don't want to touch some of these issues because we're afraid of how our congregation is going to respond.
That's right.
And we're also afraid we're going to lose members, which means we're going to lose money in tithes and offering. And at the same time, we had to remind them, do an assessment of your congregations and your communities of faith to see what they do want to learn and how they want to learn it in the discussions, because the same way you're concerned with your membership numbers and your tithes and offering, be concerned with the congregation and the population that you serve. And for those that do bring the Bible and talk about the first thing they go to is Sodom and Gomorrah, I have to remind them, let's not run to Sodom and Gomorrah, because God did not remove and to make happen in Sodom and Gomorrah pertaining to the type of sex individuals were having. It was because he could not find a person with what? It was about the heart. The heart of the people. He could not find the heart of the people. He wasn't focusing on the position and the sex that people were having. So these are things that we have to put the word back in place with those individuals that try to lean and lay on the word. So our communities of faith have got to step up to the forefront, because no matter what, our Black people, Indigenous people, and people of color do have some type of association with a community of faith. And if our community of faith is letting us down, where else can we go? So,
That's
you
right.
know, we have got to start pushing
That's
and
right.
encouraging our communities of faith. And let me
That's
just go on in, some of our faith leaders, it's time for them to come out of the pulpit, because nothing take place in the church if the faith leader does not believe in it and does not support it. And some faith leaders do not want you to remind them of what has taken place in their church: outside children, extra marriages, interchurch affairs, all of these things. They do not want these constant reminders, because when we talk about sex, sexuality, sexual orientation, the first thing people start looking at is themselves. And once again, we have painted the body, sexuality, intimacy, pleasure to be nasty, disgusting, and it is a sacred rite of passage for people that are married. And we have got to remove all of that.
Yeah. Thank you for that. You all brought up some valuable points. The intersectionality of issues is really something we do not discuss enough. You talked about with the policies, people start to look at themselves. That's all having to do not only with physical health, but that's mental health too, right? There is a policy that no one brought up that I would be remiss if I did not say this. If you look across the map and you look at the states with the highest case rates of HIV, as well as other major health issues, those are likely states that did not expand Medicaid. And when you're putting people in office, if you're putting people in office who are not going to support the idea of bettering the health of people by the expansion of programs such as Medicaid, that is an issue. And here's where oftentimes we wonder, well, what could I do? Your vote could make a difference, because someone expanding Medicaid could likely, as Alicia mentioned, access to healthcare. We then increase the likelihood of people's ability to go to a doctor, to go to a high quality doctor. So there is truly a role for everyone, right? So if you don't want to talk HIV out loud, that's fine. But consider looking at candidates that support policies that are going to help the greater good. And anybody who supports anything around overall healthcare, we should look at those candidates and consider casting our votes for them. We absolutely should. So the expansion of Medicaid, we look across the map, southern states, you all mentioned about the Bible Belt. Southern states are the hotbed for HIV. Mississippi, Louisiana, Alabama, Arkansas, Tennessee, Texas, Florida. This is where you're seeing the highest cases of HIV. Now, to me, it doesn't make sense. How can we, as Linda said, we're going to beat them with the belt and bash them with the Bible? How does that work, people? Like, really, how does that work? How are we showing love to our fellow man if we're saying, if you got HIV, you're now the leper? Because if we want to talk Bible, they're the lepers of this time. That's how we treat most people who are living with HIV. So that's wanted to just, bring that to the point. Aspen, let's talk about a little bit of a deeper dive into intersectionality of issues, particularly when we start to talk about the intersection of HIV and other health issues, HIV and mental health, particularly. And then Alicia, I'm going to come to you about how Open Arms has been able to look at the intersectionality. So Aspen, if you could talk a little bit about the mental health aspect.
Okay. So when we talk about mental health, what are we talking about? We're talking about how people feel, how they think, their behaviors and their actions. So mental health drives what you do. It drives the decisions that you make, but also drives who you sleep with and if it's protected. If we're talking about someone who's dealing with bipolar, a lot of people throw that name out, bipolar, bipolar. But what does it mean? It actually means a person who have two different moods. They can be depressed, and depression means sadness, lonely, don't want to get out of the bed at times, or they can be very, what I call manic. And that just means they have a lot more energy. They want to go out, they want to party, they buy things that they, hey, I need this, I want it, and I buy it. So when they're in that state, they engage in what I call unprotected sex. They don't think about the consequences. They're not thinking about what happens next. All they're thinking about is, I want to have a good time and I want to feel good. So when we talk about our young ladies, and I want to talk about that because we have to, when we talk about depression and we talk about low self-esteem, right? That's a part of your mental health. So if you take a young woman that's 17 or 16 years old, father wasn't in the home, mother works 2 jobs, she has to take care of the brothers and sisters in the home. When you think about that, this individual have what I call low self-esteem. And so she meets someone, could be an older individual, could be a younger man, that provides her with that self-esteem that she needs. And so what does she do? She lower her guards, and then she engages in unprotected sex without asking the question, how many sexual partners have you had? Have you been tested for HIV? Have you, do you believe in having sex with multiple partners? These discussions are not taking place because guess what? It's a feeling. You fulfill something that I have because I have that low self-esteem. So I'm going to give my body to you. And then after I give my body to you, what happens next? When they don't call or they don't call you, they don't, respond now to your mental health needs, and then the pattern repeats itself. So mental health is one of those things that we have to talk about, especially in our Black community, because what goes on in this house needs to come out the house. It's time for us to talk about depression. It's time for us to talk about mental health, because we are not doing it, and our kids and our young adults are suffering. They are suffering because we're not talking about it, and we're not linking them to healthcare professionals that can help them. Depression is not something to be sad about. It's not something to be ashamed of, but the stigma of, if I go and talk to someone and let them know that I'm having these problems, how would they view me? What will happen to my social status? How will my family act? Because I was taught what happens in this house stays in this house. Mental health has to be addressed. If we're going to end the epidemic, you have to start having that open conversation about, how are you feeling today? What happened to you? Let's talk about trauma. And that's another discussion by itself. But trauma is happening in these people's homes.
Absolutely.
A lot of the males that I interview, they have told me that my mom's boyfriend molested me, but we're not having these conversations. We're not having the conversations because a lot of us are too afraid to ask. And
we're afraid of what the answer gonna be. We're afraid because if I find out the answer, then now I'm responsible for a reaction.
Exactly.
And I want to react because Billy Ray pays for my phone bill. Billy Ray keeps the head up, keeps a roof over my head. Billy Ray takes care of all these things. And if I ask this question, then I got to deal with the answer. Right?
Deal with the answer.
And I got to take some responsibility for my role.
Exactly.
Yeah, I got to take some responsibility. So, Espen, thank you so much. Alicia, before I get to you, I want to address a question that has been posed by a member of our audience. So how do we change the perception of stigma without changing the hearts or the heart of the community, the church? So how do we change the perception of stigma without changing the hearts or church of the community? So as a PK, Alicia, if you want to hit that, and then Linda, maybe if you all want to, just a brief answer. What do you think about that?
For me, I would say a culture of caring. The church is supposed to be a safe space. When we're coming in, when you think about, again, civil rights, they came, they were burdened, they were stressed, they were released. So it should be the same concept. I think when you come in, it shouldn't be any judgment. People hear the word, they take the word, and they use it how they perceive it, or, based upon what was stated. The word should be one that's hopeful, gives you life. And so if I'm coming in and I'm already feeling a certain way and now judgment is on me, that pushes me away or disconnects me. So I think that we start just from a perspective of love, a culture of caring, you know, that's what Jesus did. Love thy neighbor as thyself.
And you just brought up a thought. Is that a possibility as to why? So I was again doing some research, and I'm very heavy with work in the faith community, looking at how we address things. And there's research currently landing that's saying in about 20 years, the Black church is going to be non-existent.
Yes.
There won't be anyone,
Yes.
right? So I think I'm hitting on your street, Linda. Go ahead. I see you.
Look, you all in the block on the porch.
Yeah.
I completely agree with what Alicia says. It should be love and compassion. These are opportunities for education, and not just educating the faith leader. We've got to educate the pew leader. We've got to educate, matter of fact, lean more to the pew leader and the people that are in the true ear of the faith leader or the congregation leader, and also encourage health ministries and particular topics in health ministries. A lot of education is needed, and even start partnering for organizations such as this that we're on the platform with, start partnering with faith-based organizations as well as communities of faith. Go to the church and have particular events. We're changing. We don't want to change the culture, the true culture for what the church or the temple or mosque was created for. What we want to do is create a paradigm shift through education to be more open and receptive without being judgmental and condemning. And that is really through education, because unfortunately, we're dealing with us. And for a lot of us, no matter what age, we don't think things matter to us until it happened to us or somebody that we know or is close to. But we've got to come out of that way of operating, because it is killing our communities. And yes, the Black church, people are doing heavy migrations away from religion and going more to the spirituality. What they say, if you got to go around the church to get to God, pave your way.
That's right. If any of our audience members are wondering why we are honing in on this, it is really because when you start to talk about HIV, really is a social justice issue. And the Black church has been on the forefront of social justice issues for African Americans since the beginning of time. And so it is atrocious that this is a social justice issue that the Black church has decided it's not going to back. And it's costing people their lives. Church hurt is a real thing. It is a real thing. But if we're not going to address this issue in the long run, I think the thing that the church values the most, which is people, they won't have, because young African Americans are pulling farther and farther away from this, from the idea that you're going to teach me to love people, care for people, except for this person, except for that person, except for this person who did this or did that. And so I want to encourage also, thank you for that question. If you do have questions, please put it in the chat. We want to address those questions. Any questions that you all may have, we want to address those questions. I told y'all this was a dynamic panel. We're going to talk a little bit about access to care. So I heard someone bring it up a little bit earlier. We talked about it with the expansion of Medicaid, but Alicia, talk to me about access to care. What is Open Arms doing that may be a little different that increases access to care compared to maybe what other people may be doing?
So we have a mobile unit that goes across the state, and we also provide free HIV testing for STDs, Hep C, HIV, but we don't call it free testing. We call it becoming a healthy you. So what we wanted to do is take the stigma out of patients calling and wanting testing and having to say over the phone, I want an HIV test and maybe someone around them. So it's called a BHU. So when they come in or they say, I want a BHU, we already understand or know what that means. Now they can opt out of the additional test if they just want an HIV test. But again, it's called a HIV, a Becoming a Healthy You. HIV, syphilis, gonorrhea, and chlamydia are the main tests, as well as Hep B, Hep C. Our mobile unit pretty much works with any organization that's interested. We do a lot of testing with colleges, universities, faith bases. We do work with apartments, whomever contacts us, and we have an available date, we're willing to do testing. What we found as we talk about the youth is, as we're doing more testing on the colleges, we're finding out that we're getting a lot of positives, STDs, and it goes back to the sexual education. 19-year-old females are coming in, oh my God, am I gonna die? Is it treatable? And it's like, yeah, but are you, has anyone told you about STDs? No, when I was in undergrad, when I was in high school, my parents really didn't talk about it. Now I'm in college and yeah, I've kind of gone, wow. So we see that there's a disconnect. So what we also do is we have sexual education classes that can be offered. So our mobile director is excellent in talking about the sexual education around, what you should do, just having that conversation. We do risk assessments that are embedded within the Becoming a Healthy You to get a better understanding of the patient, what's happening with them. And then we also have another program on the My Brother's Keeper side, that's Packard, where we do trainings for parents and students. And so we've been able to, because the sex education is not what it should be in the schools, we offer that program as a way for schools to get the training. So it's not just the student hearing it, but also the parent. So then the parent and the student can connect the dots and have those conversations thereafter. Again, what we're finding is 13, 14-year-olds testing positive for STDs. When we call to treat the patient, parents are in disarray. Because under the state of Mississippi, a child starting at the age of 13 can come in and receive family planning services. Under family planning, that means birth control, contraceptives, condoms, and they can get testing for STIs. So we're having to do a lot of education with the parents when we come to the campuses. If the child tested positive, even if you don't want to pay, we have grant funding that will pay, and that we don't have to disclose the result to the parent. If the child is with you, we can disclose it there. So it opens up additional doors, but it's collaborations with the school districts that allow us to come in. And most of them are our community. We spend a lot of time in the Delta. We spend a lot of time in at Hines Community College, but we've just seen over the last year that there's more work to do. Through COVID, we had our highest numbers. Now everyone was supposed to be at home, but through COVID, we had the highest numbers of syphilis and HIV within a 2-month span. 2-month span period. The highest numbers ever come out the clinic. And so it's like, okay, everyone is at home, but what they doing at home? They're going from house to house.
They're going from house to house.
They weren't concerned about COVID. I mean, we were popping out. I mean, the clinic was closed for a while. We were regrouping, but it was our mobile that we had out doing the testing.
That goes back to what Aspen said about the mental health. If I just want to feel good. So in the middle of COVID, people were struggling mentally, right? So they were struggling with loneliness, they were struggling with abandonment, they were struggling with all of these different things mentally. And so they turned to the easiest, and sex is free. I don't have to pay anything. I can go and for 5-10 minutes, I feel good. I feel loved. I feel cared on. I feel, right? We cannot underestimate the value of feeling. What we got to change though is what and how people begin to feel good about themselves, right? That's what we got to change. So that ties absolutely 100% in to what Aspen just said. Just hitting on those STDs. As a state, the state of Mississippi now ranks number 1 in chlamydia, number 2 in gonorrhea, and we are number 4 or 3 in syphilis.
Yep.
This state, we had gotten out of the top 10 with HIV. We're now back in the top 10. We're number 7 now. So when you start to think about STDs, what baffles me is that people will go in, get tested for gonorrhea, test positive. I got you coming, Miss Linda. Test positive for gonorrhea, test positive for chlamydia, test positive for syphilis. And do you all know some healthcare providers do not offer them an HIV test? That is absolutely crazy to me. We got 2 questions, and then I'm gonna come to you, Linda. Comment as a pastor's wife. She's had several conversations with young ladies who want to talk to their parents about sex, but they're told they're too young, but they are having sex. We do have kids out there having sex without knowledge, because parents, again, can't face the reality that their child may be growing up or making some unsafe decisions. The next question is, if someone tests positive for some more common STDs, do we offer medications or vaccines? She knows a lot of young women are educated about the HPV, aren't educated about the HPV vaccine. So, Alicia, I'll let you, if you can give a quick answer to that. If someone tests positive around the more common STDs, do we offer medications and vaccines at Open Arms?
We do. We would provide the STDs are testing is free, treatment patients have to pay for, but we also have a sliding fee scale. And then again, depending on age, we put them on Medicaid family planning or under the family planning. So we do provide treatment for any patient. We have a linkage. Patient test positive, nurse and provider will contact them. We can send over a prescription depending on which STD that they test positive for. They will have to come in. Education is done. We do also provide the HPV vaccine, which is also under the Medicaid family planning. Medicaid family planning is for uninsured or underinsured, and it starts at age 13 on up, but that's usually used to kind of assist that process for patients who need additional assistance.
Okay. So Linda, I'm going to go to you, and then Carrington, I have a question for you right before we get ready to wrap. So Linda, I'm going to go to you.
I can hold mine to my wrap-up comments if you want me to.
Okay, sure. So I'm going to ask you, as we prepare to wrap, what can we do to change this? Everybody's talking about that we're not having conversation with young women. We're not having conversations enough. What can we do to change this? What can
I believe first what we have to do is get uncomfortable, because I don't know if I said it earlier, but I feel like our community is prone to just being comfortable with a lot of things when it comes to killing, shootings, when it comes to having HIV and not talking about it, having AIDS, not talking about it, having intercourse and not talking about it, or being concerned with our bodies as young females or even as males and going through depression. We just are comfortable with things that we're told to like not talk about, or things that we're scared to talk about. So I feel like we just have to get uncomfortable, like come out of our shells. Like as African American people, like both female and male, I feel like we need to know that we have each other. Like just because the stigmas are so bad, which are, a stigma to me is a lie. Stigma to me is a personal opinion that can be overridden by you as a person, because what somebody says about you does not determine your life at all. So I feel like the biggest thing is just to get uncomfortable and actually start walking out on not just faith, but action. Like if we start talking about these things, we have to just apply that pressure, like start working towards helping people and being there, being a listening ear, wanting to talk about things, and just like I keep saying, just being uncomfortable. That's how I feel like it will happen. It's just us getting out of these shells that we have, because a lot of people have these tough shells, but on the inside, everybody needs a helping hand or just an ear to listen to, somebody to hear them out. In the heart, just everybody needs a love.
Absolutely. Now, and that's coming from a young person. So that is coming from a young person. We do have a question. We're focused on HIV through sexual encounters, but 1 in 10 contact HIV through IV drug use. Are there agencies still distributing clean needles? So I'll just tell you, in the state of Mississippi, the distribution of clean needles is not legal. That is not legal in the state. Also here in the state of Mississippi, when we talk about HIV, we're talking about encounters from sex. We don't see very high encounters or transmission through IV drug use here in this state. That is very common on the East Coast. That's very common on the West Coast, in areas like West Virginia, and larger cities, DC, New York, LA. That's where you see a lot of the IV drug use. There is an increase starting in the Kentucky area, though, mainly among whites. That's where we're seeing the highest case rates among IV drug use. But in the state of Mississippi, the distribution of needles is actually against the law here. And so when we start to talk about policies that need to be modified, then we certainly should have policies in place where there can be clean needle distribution sites and agencies. But in this state, it is illegal. We are coming close to time. Our hosts from Delta are going to drop some the evaluation in the link. I am going to ask each one of my panelists, just take, if you all can hold with us, maybe just another 10 minutes, I assure you, but I would like to give each panelist the opportunity to just say a closing word, and then I have some closing words. 1 minute, I'll start with you, Ms. Linda. 1 minute. What do we need to do moving forward? I know this is so hard.
I know, right. Okay, what we need to do to move, what would be great moving forward. First thing is we talk about voting in elected officials. I would say let's start with your school board, because the only options are abstinence and abstinence plus. Your school boards determine which is taught. Start pushing for more than abstinence and abstinence plus. The other thing is the data that you're hearing, and correct me if I'm wrong, Dr. Munger, that's 2019 data. What has happened between 2019 and now? The pandemic, and people in the house, we have pandemic babies. So that means we have what? STIs and STDs, especially HIV, and we haven't received those numbers yet, and probably won't get it to 2023.
The 2020 data is what I'm actually going from. Is that we've seen STDs and STIs increase during 2020. So but they say that is not comprehensive because they know that there's some stuff missing.
That's right.
If they're saying we're 1, 2, and 3, and the data is not comprehensive, I'm afraid when they do get all of the data from 20.
In my last 20 seconds, because you just took 15 of mine.
I know, I'm sorry.
Okay. My last 20 seconds, I would definitely say for the knowledge and the work moving forward, can we look at the whole population? When we talk about sex, it's more than youth and teenagers. If you have the anatomy, the stamina, the interest, and the will, we need to be talking about it and involved in the work, because from 8 to 80, blind, cripple, or crazy, all that don't walk, we drag. So let's really talk about adults, and especially with this being a sorority, a women's organization, we've got to get on the forefront pertaining to women's health, and not just one time a year. Every month we should be pumping and pushing something beneficial pertaining to women's health, especially Black women's health.
Absolutely, absolutely. Aspen.
Okay. In my closing words, this is something that I would like to say. I had someone close to me who was diagnosed with HIV, and they came and they informed me of their status because of what I say about HIV, how I value people living with HIV. We have 121 people on this chat. I employ each and every one of you to start the conversation. We cannot do this without you. It takes all of us. It takes us talking about HIV with our family, within our churches, with our sisters, our friends, with even our providers. I want you to understand that a provider, just because he or she is a doctor, they're not going to ask you if you need an HIV test. You have to make sure that you are testing and also having that conversation, because like my lovely soror stated, we have to be uncomfortable. We have to start having the uncomfortable conversations with our children, with our sorors, with your friends. If you have a friend and you know that that friend is having unprotected sex, talk to them and let them know about HIV, because it's real. Bring them to Hattiesburg Family Health Center. We can do free rapid testing and have that conversation with them as well. And then in my last point, one of the things that I would say the most, like I said before, we cannot do this without you. The conversation has to start. And it's not just if you have a friend who is the same gender loving, a male who have sex with other males, there's PrEP and there's PEP. And that resource is a type of medication that one can take. PrEP, you can take it to prevent the transmission of HIV, and PEP, if something happens, you can take it to prevent HIV to be transmitted to you within a certain time frame. Get this word out, talk. We cannot do this without you.
Absolutely. Thank you, Aspen. Ms. Barnes, closing point. You on mute?
Be open-minded, transparent. I think that we have to treat others the way that we want to be treated. As Ms. Linda said, that we don't react until it comes home. So being more proactive. And then also, we're starting an initiative with self-testing. So even if you don't want to go into a clinic, self-test. Girls' night, we are gonna self-test. You're with your support, with your people, your friend. So being innovative in how we get into communities, how we do the work. I think we have to redesign the system in order for us to see the change that we want to see.
Absolutely, absolutely. Carrington, any closing thoughts?
Yes, ma'am. I want to have my closing remarks. I want to start by just reminding you all to just start asking questions, get out of those comfort zones. Understand and remember that a person is a person. So all people are people, no matter if they have HIV and AIDS, no matter if they had COVID. They how we were so big on oh, she coughing behind me. That's still a person, So it doesn't matter. Treat people how you want to be treated. As Ms. Barnes said, take the necessary steps to prevent HIV and AIDS. No matter how much you feel like eyes are on you, it's for your own benefit and just for your own health in general. I want to remind you all to be encouraging to everyone, because you never know who needs a word and you never know who's going through what, because like we said earlier, everybody is not going to speak up when they're going through hard times or when they feel like they're being vulnerable, because we don't want to seem weak in this type of lifetime, but it's okay to sometimes. And then lastly, I just want to end with saying that things that have enough weight to shift the world or the ground beneath us to have to start a movement or have a World AIDS Day, something that's this strong to put a shift in the earth, I feel like that it shouldn't stop a movement, or it shouldn't stop you from talking about it or wanting to know something about it, but instead lead you to move. It should lead you to move different. So if you start moving different and start talking different and start talking positive and inspiring others and just encouraging others and having the certain information that those need, that, because you never know, you could have something deep down inside you or instilled in your heart that somebody needs to hear or needs to know, because like I said earlier, I didn't know until I knew, until I had to know that people were my age going through things. I'm just wow, it could be me. So that's my closing remarks. And again, I just want to thank you all for having me be a part of such a beautiful panelist group this evening.
Thank you so much. So I want to just say to you all, thank you. I asked you all for 10 minutes. So thank you all for staying with us. Be sure to complete your evaluation, your survey. The ladies of Delta Sigma Theta, the Jackson, Mississippi Alumni Chapter, will be hosting events all the remainder of the week at the Jackson Medical Mall, where you can go over and get tested. The focus is unmasking the stigma. So if you've not been tested, go over, get tested. If you don't necessarily want to go to the medical mall, but everybody's going to be there, if you don't want to go there, that's fine. You have Open Arms. You have Linda up there in the Delta. You have Aspen down there in South Mississippi. So you got options. If you don't want to come right here in your own community, there are places all over this state that you can go and you can get a free HIV test at no cost. At no cost, you can know your status. As I wrap up tonight, I want to thank the ladies again from the Jackson, Mississippi Alumni Chapter for inviting me again to moderate this year's panel around our World AIDS Day event. It's so important that we continue this conversation. I want to note that tonight for me was a call to action. Consider hosting an event. Consider organizing and mobilizing with AIDS service organizations. I encourage the sorority even build expertise from the inside out. We should have, ladies of Delta Sigma Theta, you all should have women who can talk about this at a drop of the hat. This is a focus for you all. So consider building that expertise from the inside out. Make sure that we're becoming and creating space for open and ongoing conversations with young and seasoned women. Linda mentioned that. If one of us is living HIV positive, then as are we all. Gone are the days that we focus on who has HIV and how they got it. It is time that we treat it as any other social justice issue. That means action and voice. The words, we can't just do the words anymore, ladies. We cannot do the words anymore. We have to seek to summon the entirety of the community. Your church, your school, your job, it doesn't matter. If you got a young sister or a good friend, it's important that we have a conversation. The days of box checking around this epidemic are gone. We got to stop checking the box. We got to stop checking the box. World AIDS Day is great that we focused on it this week. I said it last year, I said it the year before, and I'm gonna say it again this year. We need to have events ongoing. There needs to be space and time for these opportunities. We know an hour is not enough. I know there are hundreds of questions still out there. So if we're doing this on an ongoing basis, then we don't have to worry if we get it all in 1 hour or in 1 week. So again, thank you so much for having me. Thank you for the panel, this illustrious panel of women. Black women truly are the foundation of this world. We, as Ms. Carrington said, we can shake the world. We must protect the fragility of our people. It has been our responsibility since the origin of time. That has not changed. Thank you all so much for joining us tonight. You all be safe again in this weather. Safe prayers for safety to you and your family. And to the ladies of Delta Sigma Theta, I'm going to turn it over to you, to the committee chair. She's about to take it over. Thank you all so much.
Thank you so much, Dr. Munger. This was wonderful. Thank you to our panelists. You have truly given us food for thought this evening. And this conversation, as Carrington said, it needs to continue, and it will continue. We have opened the door for these tough conversations to begin, for us to take them back to our jobs, our churches, our families, our communities, and just to continue. We have something for each of you, just to thank you for taking time and spending time with us this evening and sharing just a little bit of what you do and how you have contributed to this event that we're having this evening. And we hope to have you again. Thank you so much. We will be getting with each of you before the week is out. And thank you to those of you who joined us this evening. The storm passed over us and allowed us to continue. So we know that this was important work that needed to be done. Again, have a good evening, be safe, and we hope to see you all tomorrow evening. Thank you again.
Thank you.
Everyone be safe and have a good night.
All right. Thank you.